Hey everyone, I am back for another episode of Life Possible with a Disability. And today we are going to be talking about one of my favorite subjects in the whole world, which is standing and seat elevation. Standing is my passion for anyone who has a disability because I think there's a lot of medical benefit in it and there's a lot of proof of that. This particular subject that we're talking about today is about standing and seat elevation for people who use power wheelchairs. And I have my new friend, Nicole LaBerge, with me today. And so I was introduced to her by Kara Massenlink, who both of us have done a lot with. I think Nicole more, but I've known Kara for a while now. And we have other mutual friends. And we shared this passion, and we were kind of shocked that our prep call was like the first time we have spoken. But Nicole's got an impressive resume, and I will, without further ado, let Nicole introduce herself.
Thank you. I have to say it's an honor to be here with my new best friend. So excited. And also, yeah, it was very odd that we haven't become friends so far, just with the similarities in how passionate we are. I am a physical therapist. I practice out of Minneapolis, Minnesota, almost Canada. And it's cold here. And I've been living here my whole life. I've been a physical therapist for a little over 15 years and got really into the seating mobility world pretty quickly, and have been an assistive technology professional for 13 years. So really done a lot with seating and wheelchairs and standing. So about 10 years ago, I was introduced to the option of having a power wheelchair also have a standing function on it, and really dove in and thought, well, this makes so much sense on so many areas, not only the medical benefits, but also the functional benefits, and have been getting them for my patients for, like I said, probably the last 10 years. And I would say, I was thinking about this, Karen, I'm pretty darn close to having done maybe 100 at this point.
It's amazing.
I should get that tally. But that led me down the road that I currently am doing. So I am a clinician and I practice 4 days a week as a physical therapist. And then 1 day or so a week, I'm digging into the research and getting some publications done and out there, and then just really advocating so that more people have access to these awesome.
Nicole is being a little modest, but she has been extremely successful, the most successful in the country, really, for getting approval for standing and seat elevation for power chair users. And, you know, it's not easy because currently Medicare doesn't cover it. And they say that it is the wording not medically necessary, or
not medically necessary. And when they view things as not medically necessary, they view them as items of convenience, which is
I want to use some words to say how dumb that is, but I'll try.
Yeah, it's when you, Karen, I know you're going to share your story here too, but when you have your injury, whatever experience brought you to needing the wheelchair, just prior to that, I can guarantee you that you were standing and walking and upright. And so it's really hard for me to know that there's technology and equipment out there that would allow you to do the same thing. But because of that injury, something you were doing moments before that happened, it's no longer necessary per our insurance guidelines. And that's where I think has been my biggest push, is that I've seen so many of my patients benefit from it and have it change their lives and to make such a difference. And it's hard for me to continue to see that those rules are against them when they want something.
Right. And
too long
so
ago.
when Medicare is the gold standard for insurances and Medicaid. So a lot of times, because Medicare doesn't cover it, everyone else, when it's convenient for them, I hate to say, will say that we follow Medicare guidelines, and they'll also deny it. So my personal experience with standing, I, uh, anybody who's been listening knows that I was shot in an armed robbery when I was 19. That was 34 years ago. And in 1987, prior to the Americans with Disabilities Act being signed a long time ago, there was technology for standing. There was, I used a reciprocating gait brace. There was also a power standing chair. It was clunky, but it existed. So, for 34 years plus, different standing frames and different powered mobility, even with standing features on it, has existed. And I realized back then, maybe not now after all that I know, all of the data that exists, but standing was going to be important for preventing a wound, for my posture, for bone density, for digestion, for being functional, for and psychologically, there are some aspects to standing that, obviously, Medicare and Medicaid might not be concerned about, but just from a quality of life aspect, that a lot to be said for. Yeah.
Absolutely. Absolutely. I, you know, they focus a lot on the medical benefits, and that's great. And there are huge medical benefits to it. You just named a bunch of them. So, changing position, preventing the chance of skin breakdown, helping with managing spasticity without having to take another medication, helping to manage pain without having to take another medication. I sit in a conference for 2-3 hours and I'm going crazy. I want to stand up, and I stand up, and what does everybody else do? They run to the bathroom, right? Like, this is, oh, your body's telling you, as I'm moving around, things are flowing again. And so the benefits for standing in the able-bodied population has been studied. We know that. We have our smartwatches. We have our reminders, get up and move. And then there's this disconnect to someone who has a disability, and it says, "Oh, just kidding, you don't need that anymore. You're fine. You can just sit." But yet we know that when you have a disability, you're at higher risk for those secondary
and they talk about medical equality, like that's the big push right now in CMS, and there's so much inequality. And as a result of this, of me deciding to stand with any device I could get my hands on for the last 34 years, and I also use functional electrical stim, which we're not talking about right now, but it's also been very beneficial in my health. I've never had a wound or a fracture or a contracture. So, in my ankle joints, I mean, most people have dropped foot and then they're having Botox injections and, like you said, pain medication. I've never taken a pain medication. I've, I never had issues with constipation. The list goes on and on. So it blows my mind when, Veridesk is a thriving business in the United States and probably around the world, where people say stand more because it's healthy and we've got all this, but if you're unable to do it on your own, it doesn't really matter. And infuriates me. And I argued with doctors back in 1987, and I was like, this is my one. They're like, why are you bothering? It's not, you're never going to walk again. And I was like, well, number one, you don't know that. Number two, if I don't take care of my body, I'll never benefit from any cures that might come up in the future. And let's just say that never happens. I plan to live a really happy, healthy life and be a mom. And so I'm going to take care of this one body that I was issued for this lifetime. Thank you very much.
Well, and so here you just said exactly what they're trying to prevent. These, I shouldn't know. Let me back up there. They're not trying to prevent. They're spending the money of reacting to the wounds, to the fractures, to the contractions that you have. Like, those things are all expensive. So if you're getting Botox, if you're taking medications, I mean, wounds, that's something I do 2 days a week. I work in a sacral wound clinic, and that could all be prevented with something that really isn't that big of a expense up front. And so that's,
Mm-hmm.
props to you for advocating for yourself, because that is huge. And that's what people should have access to. And they shouldn't have to go to such extensive lengths just to be able to do something that is going to help them prevent and
Yeah.
actually save money down the road if
And people
if they
like
had
this,
access
the
to it.
therapists and the consumers that are using these technologies, when we get to be in front of a legislator, I think when they score these bills, whether it's on a state level, and I know on a federal level, they don't score the preventative part, right? They just show the cost. Although this is a very small percentage of Medicare beneficiaries that would even qualify for it, and the cost savings
Yes.
really isn't factored in. So I think when we're having those conversations with people that make the rules, like that's always a great point, Nicole, to bring up. Like this isn't going to cost you money; it's going to save you money.
Yes. Yes. And then, I mean, yes, the medical benefits are there, and we know that, and we have the research to show that standing can be so huge for somebody's body, but the functional part of it too. So, I want to continue to work. I want to continue to be in school. I need to be able to stand up to get to an area of my office. I want to be able to give a presentation just like my classmates. Or I want to be able to go into a bathroom at a sporting event and actually use the urinal and stand up instead of having to sit and cath. Like the things that are so small to somebody who is able-bodied, they don't think about it, can be so impactful and so huge to somebody who's like, wow, I haven't been able to do that, and
Right?
now I finally can
I
again. That
Huge.
that to me is,
Like at home, I cook.
yeah.
Um, and like even carrying so I have a different device. I have a Tech RMD, which RMD is robotic mobility device, and that's specifically for someone who has the upper body strength. They use a manual chair, but I'm mobile and standing at the same time. So the same principles apply as far as function. And in my personal experience, number one, if I can stand while I do a functional task, I'm going to stand a longer period of time, because standing frames, you are immobile.
Yes.
They're very difficult to transfer into, especially if you have upper body impairment, and they're not utilized as much. So I've had this argument with therapists too, where they're like, they don't need that. They can just use a standing frame. I'm like, you know what? No, 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 we can't. I mean, it's not the same.
Oh, no. And that's okay. So go back 10 years, and that was my, I'm getting my patients their power chairs and manual chairs. I'm getting them the separate standing frame. And as my experience had showed me, that if it takes time and it takes energy to get into that separate piece of equipment, my patients were less likely to use it, and they were less happy about using it because then they're stuck in one place. So yeah, you're getting the benefits of standing upright, but now you can't do anything else. And so what, I'm
Mm-hmm.
telling you to watch TV, or I'm telling you to
Mm-hmm.
do a crossword puzzle. Well, or if you could get into your power chair for the morning, and you can stand up and you can get yourself breakfast, and then you can sit back down, and then you can cruise into the bathroom, and you can stand up and you can go to the bathroom, you can wash your face, and then you can sit back down. I'm like, that is more functional, but it's also going to
Yeah,
increase
for
your
sure.
compliance. You're going to use it more because it's built into
This
your
sounds
day.
hilarious, but I
And
dusted
then you're
all
not,
sorts of things I had never
yeah,
reached in like 30, like, because in a reciprocating gait brace, I was contact guard assist because I could fall. And then with the walker, my hands are, white knuckling the walker to shift my weight. It's tough, right? And then there's the standing frame where I'm
yeah,
like standing around looking at all the things I need to do and I can't do them. But yeah, like I dusted
yeah.
like the top of everything. And like this morning, I couldn't reach the cranberry juice because one of my kids probably came over and like shoved it to the back. And I'm like using a stick to pull it forward. But guess what? I can reach my own stuff if I can stand.
Yes. I had a patient that we were getting a standing chair for, and his mom told me that the only place that used to be safe in their home to keep things out of his reach was on top of the refrigerator. And now, because he had a standing chair, she's like, I have to find a better spot to, keep
Yeah.
this stuff that we don't want so and so to be able to access. And I'm like, I get it. I do get it.
Mm-hmm.
But good for him and being like, finally, I can actually get up. And that, to be fair too, that's somebody who was,
Wow.
nonverbal. They weren't able to like use their words. They moved and they pointed and they physically, that was
Wow.
how they communicated. So that was pretty amazing. But I can't, like, we, we have like organizations that come to our jobs and they're like, hey, like, you are reaching too much above your head or you are bending over too much and this is going to put you at risk for an injury. And then it's like, well, no, you're in a wheelchair, so you're just going to stay at this level and function in a world
Mm-hmm.
that is not at your level.
Yep.
And that's supposedly okay to just be here
Right.
and to
And then
potentially
with
hurt yourself or
the seat
fall.
elevate, yeah,
Like
that's another thing is like one fall and, standing helps. I know the data is not super clear on this, but then again, we don't have all the studies that we wish we had to prove some of these things. But bone density is an issue for people with who can't stand, and so falling, we're at really high risk for fracture, which could change things in a really bad way.
uh, it's huge. I mean, a fracture, when you look at that spirals, you're going to have to go, you're going to have hospitalization, potentially a prolonged rehab recovery. And then you're going to hope that in that situation, all of the healthy habits that you've been able to maintain prior are still going to be encouraged, your diet, your movement. And so then you start to spiral down this like additional
Yeah.
complications that could
Yeah.
have
Bed
been
rest is
prevented,
gonna
and they're
could possibly
expensive.
cause a wound that wasn't there before. The
Yep.
the seat elevation thing, like when traveling and moving around. Now, we this is not something that Medicare cares about, but a lot of people, there's a shortage of caregivers right now. When a person with limited upper body mobility or strength needs to do a transfer, whether that's to the toilet or to the bed, and if they're traveling, beds are all different heights. I can attest to that as a manual chair user. I've had to learn some acrobatics if I wanted to sleep at times, but yeah, no,
You don't need
over
to
it's
sleep, Karen.
overrated.
It's fine.
Yeah. So, but the seat elevation feature, I know on it, we also have to preserve our upper body joints and our shoulders as wheelchair users. And so, I don't know, maybe you could speak to what you've seen that seat elevation feature helps.
Yeah. Yes. Yes. So I mean, first of all, pushing your wheelchair using your shoulders, like our shoulders were not designed to, our arms are not designed to be walked on, right? So you have that, you're already at risk for overuse, injury, pain in your shoulders. But the actual amount of like force that you have to push through your shoulder joints in order to lift your entire body weight is huge. So depending on how many transfers you have to do, typically it's dozens during a day. If you're going from a bed to a wheelchair to a toilet, your vehicle, that's a lot of force and impact and strain. But as a physical therapist, I am going to use my physics that I loved in college. That was sarcastic.
I
I
was
did
like,
not love
God
it, but I
bless
had
you.
to
That's
take
why I'm
it.
a social
And
worker
guess what?
because I don't like that
Uh,
stuff.
it was I think I got a sympathy passing grade because I was just like, gosh, I kind of understood it. Now I'm like, I get it. It is easier because of gravity to go from a higher surface to a lower surface. And so it's easier, but it's also placing you in a safer position and decreasing your risk of falling. So if you come in and I say, Karen, I'm going to teach you how to transfer, I'm not going to have you go from a lower surface to a higher surface and say, yeah, good luck. That we know that's challenging. So if you can elevate above height, even just an inch, and now you're working with gravity, you're keeping yourself safer, you're keeping yourself more independent, that alone should be enough to say, yes, you should
Right.
have a seat elevator. But again, you think of this, the overreaching and the force that you already have to use on your shoulder. Now you're having to reach above that height for everything during the day versus actually
Yeah.
get an opportunity to elevate, grab something, and be at
Yeah.
a lower risk for injury. So, and that,
Even
you know,
skin
it's,
sharing too, like when you're
we talk about the,
dragging yourself upward, you're literally we're dragging ourselves over whatever it is. And I know that's a huge risk.
that is, and you know, people think of pressure injuries as just the pressure, but that is a huge factor in what causes that wound is the shearing of the skin. It's also the um, you know, the moisture, the heat, like those factors go into it. So now you're sweating because you're trying to get yourself uphill to a surface that you
Yep.
just need to get to,
Yep.
bed, to sleep,
Yeah.
and you're tired. So that there's a lot of there's a lot of push in everybody to conserve energy, and that's the other thing I don't understand. I'm like, well, if it's harder for you to do a task and there's this equipment out there that would allow you to conserve your energy so you could do more during the day, why aren't
Yeah,
we
that's
giving our
huge too.
patients access
Because
to that?
what someone can do at their most fresh and rested aspects is totally different from what you can do at the end of the day when you have depleted all of your energy. And that brings us to the fact that under current Medicare guidelines, these pieces of equipment would aid in the activities, medically related activities of daily living, which would include bathing, grooming, cooking, right? So we've been part of a group that is asking CMS to, by their own guidelines, cover standing and seat elevation. So, what do you have to say about that?
Yeah. Well, I was very honored and excited to be asked to join that group as one of the clinicians. Gosh, it's been too
Yeah,
long. It's been almost 2 years that we've been working on this project, that I've been
me
involved
too.
working on
And
this
we
project.
never
And
met. Still also
the
crazy, but yeah.
I also it's okay. It was meant to happen. The task of my group was to really pull together the medical research that is out there and show that it exists, and it does exist. And so we presented to CMS a 50 plus page document that basically just said, here it is. Here's the information. Here's the research and the data that you are asking for, and so tell us, you know, what do you think? Because we know it exists. And then anecdotally, I also can tell you that it changes people's lives and it helps them with their medical needs. And you said it, Karen, the mobility related activities of daily living are the transfers and the dressing and the grooming and the feeding yourself, the things that Medicare CMS is saying, yep, we will pay for pieces of equipment that
Mhm.
help you to do that. And so that's where we're at.
Yeah.
They have that information, and you want to share what
Yeah.
they're
So
doing with that information?
we took all of that, and our friend Kara, our mutual friend Kara, is kind of, she, once that data was gathered by all of these wonderful clinicians, Kara has been presenting it more than one time to CMS. And so we have been fighting for 2 years for them to open what they call a national coverage determination. So that's like the first step in CMS's process to look at their own policy, right? And for us to present an argument as to why this fits the criteria for allowing coverage for standing and seat elevation. So um, we've we kind of endured a change in administration, lots of turnover. You know, there's all these political things that go into it, but we've been waiting now for way too long for them to open this national coverage determination. What that means in layman's terms is they are going to open it up for public comments, and we're awaiting that now. We have another upcoming call, and as we speak right now, it's the 17th of December, and we are Christmas is about to happen, but next week we have a another meeting, And we are going to ask that in January of 2022, they open this NCD for public comment. There is a website, and I'm going to let Nicole share that with you. She came up with the name. We had like not a name contest, but we had a we had a it's a
No.
good
You're
name.
not supposed to
It
share
went.
that. It
You
was not my idea. And I already didn't even write it down. Um,
Rise for
because we
was
were
it Rise
because we were just
for
talking
Access? Yeah.
rise for
So,
access. Yeah.
but it's
Yeah,
for
rise
like
up
the
for access. So
Rise
that and that
RISE, the number for access, right? Okay.
rise
.com.
up for access. Yep. Yes. And that, we've been trying on the big picture, and I am so proud of all of the people who have been putting the efforts into it. I mean, I'm just one clinician compared to like this team that has been really pushing for this. But they do need to open it up, and they need to hear from the public, which is who we get to hang out with every day, and who is maybe you as the wheelchair user, or maybe it is you as the caregiver, maybe it's somebody who just might happen to work with me and knows how passionate I am about seating and mobility and standing. And so I think that's what we're also hoping, is that once it's open, that we have this website and you can go to it and you can share why you think
Right.
everybody should have
Yeah. And that's
access
why
to
we
this.
wanted to record this and have it ready to go. Literally, I'll probably share it more than once, and then I will share it again as soon as the NCD is open, and I will blast it anyone who will take it or share it, or because we're all, any one of us could end up a wheelchair user at any time. This is one of those clubs that nobody signs up for, but even if your life isn't currently impacted by someone who uses a wheelchair, it could be tomorrow. And we're not asking for we're just asking for equality. We're not asking for anything special. And we're as we said, we have a cost benefit argument as well to say, look, we're not trying to spend more of the government's money on something frivolous. This is decreases medical costs and increases function and independence. So if you Rise for Access, that's the website, and you can go in and put your comments there, and it will go directly to CMS. And we appreciate you sharing it.
Yeah. I said a couple years ago, probably more than a couple because I'm getting up there myself, but I said before I retire that this is something that will happen. CMS will understand that standing is necessary as a medical need. And so I was really excited. I thought I was going to
Really?
retire like a year ago. Well, because they
Oh,
were gonna
that's
open it up for
right.
comment, and then we were all
Darn.
gonna say yes, of course, and they were gonna
Right.
change it, and then I was gonna retire. No, so I'm gonna work for quite a few more years, but it's I'm passionate about it because I've seen it make such a difference, and of those almost 100 patients of mine, it's like it's still so exciting to see the first time that somebody has stood
Yep.
in a long time, and to know
I was just gonna say,
I was
there's
tears.
lots
We're
of
always
tears,
like,
lots of happy tears. I remember one time I stood in a standing
yes,
robotic device at
yes.
work when I was working at a rehabilitation hospital in Baton Rouge, and so I worked with a bunch of physiatrists and a bunch of OTs and PTs and social workers, and all, like I'd worked there for a really long time. And so every day I rolled in my wheelchair, did my little social work thing. I stood up at home, and people had seen pictures of it, but I demoed this exoskeleton at work, and the news was there. It was all and everyone in the gym was crying. Everyone was crying, and I was like beaming, smiling, and like, "Why are you guys crying?" But it was tears of joy, and standing next to these really tall physicians and people that I worked with, and I was like, God, I like this, like as if I didn't argue with them when I felt it's necessary anyway. But like seeing eye to eye, and then also I'm like almost 5'8", and then that thing gave me like a few more inches, and I was like towering above people, and it was just such a beautiful feeling.
Most of my patients are
Yeah.
taller than
Yeah.
me when they're in their chairs. And so, cruising in and it's like, hey, how's it going? And I try, I'm like, I'll grab my
Right.
stool. I want to be at your level. I'm not, there's nothing about me that makes me
Aw.
more important than you. And so, to see that, and then to also be able to, like you just said, I'm like, let's go cruise. Let's get into the gym. Let's go and like go for a walk, and
Yeah.
to be that. And I'm like
It's,
looking up to everybody. But I mean, just, yes, it is. It's tears of happiness. It's also, kind of, people are like, gosh,
yeah.
why didn't I know about this before? Why didn't I have this before? And how could this have changed things, my pathway? And that's my other push is, it shouldn't be the let's get you all of your
Yeah.
equipment and then later
Right.
think about standing. It should
Well,
say,
yeah.
you were just standing yesterday. You were just walking.
Yeah,
Why are you
and
not
then
thinking about
because
that
if we don't,
immediately?
then those contractures start to happen, and the bone density issues start to happen, and then they'll say it's not safe to stand, and you will have like kind of missed your window of opportunity.
Yes, yes. And that you just hit on something good too, because I know that is something that people are questioning. Is it safe and can I do it? And is this something for me? And I mean, that's where I say, get your team together and make sure that you have the support that I've stood, people who
Yeah.
haven't stood in over 30 years and
Yeah.
been very
Because you can
successful
undo some of that. You can undo
with
some
it.
of
So
that, like you can reverse some of that damage. Yeah. I mean, the bottom line is our bodies will sort of freeze in a sitting position if we, don't do anything about it. So yeah.
yeah,
Well, this
yeah.
is, I mean, we clearly could talk about this subject for a really long time. And I know this won't be our first conversation. And actually, we're throwing a big, gigantic party. I don't know. I feel like 2022 might be our year. Um, you know,
I'm
I know.
I'm gonna hope so. The last two have been
Right,
a
right.
little
I
less
don't
than our
know. I'm
years, but
feeling
yeah,
it. So
yes.
I'm ready for some, yeah, I'm ready for a gigantic celebration once we get this done. And I am so thankful for your passion on the subject and all that you do to better the lives of people with disabilities. And yeah, like truly from the bottom of my heart. And so much fun getting to know you. So hopefully we will see each other in person soon. And then for our big standing party.
Our standing party. And thank you, Karen, for being an amazing advocate and having such a similar role, but also being somebody that people can look up to and have like this awesome platform. Because I think that's the other part is that there's people out there doing really amazing things, and we have to know
Yeah,
about it in
yeah,
order
getting
to
the
be
word
able
out.
to help.
Thank you,
So
Nicole.
this is awesome.
Of course.
Thanks for
All
having
right.
me.
Well, have a beautiful rest of your year, and we will talk again soon. Oh, by the way, I will put
Sounds
any
awesome.
information that Nicole has that she can share, maybe some of the data. I don't know if it's on like clinicians' task. I'm not really sure what websites, but Nicole will give me all that info and I will make sure it's in the show notes.
Yeah, we have Clinician Task Force. We have our website, which awesome has great links to it. But one of the publications too was a policy analysis on power standing, and that is something that can be read. It's open access, so everybody can read it and see a little bit more of the process we've been
Yeah,
working
that's
with
really
to get
amazing too,
this
because
funded.
obviously the more data, that's what they want. That's what they ask for. And we've got it. So thank you. All right. I'll see you soon, Nicole. All right. Bye.
Okay, thanks, Karen.